So the issues for this one are that the devices weren't always secured in lockable areas. You need to always ensure that devices are secured within locked drawers, cupboards or rooms. And when transporting devices, they should ideally be kept out of sight, i.e. in the boot of a car, and the car itself should always be locked when unattended. Devices should not really be left unattended in any publicly accessible areas. So keeping the logon information with the device, usernames and passwords should be never be written down, and certainly never together. Password managers, such as those built into Microsoft Edge or Google Chrome, can be used, although this would be behind that first logon. Other password manager software is available, but it needs to be reviewed by the IG and IT teams. Then information stored on the device. Information should not be saved on devices, either to their desktop or their My Documents folder on the C drive. It should be stored on a secure network area. This will ensure that it is not lost should a device be damaged or lost, and it will be encrypted in line with security processes, and then backed up in line with business continuity practices. So the outcomes of this one: practice had to report the incident to the police. On review with IT, both laptops were encrypted, so that protects the data from being read without proper access being enabled. The logon details that were stored with the laptop had been disabled when the GP left, but access would still be possible. But luckily, there was no information on the device, and any further access to patient information would have required network access, which was not possible due to VPN and disabling the account. As a precaution, active users' passwords for AD, email and clinical systems were reset. Due to the above measures, information was not at risk, and it was deemed a near miss in the end rather than an actual breach. The practice needs to overhaul their security measures. Laptops used within the surgery should be kept in a locked cupboard when not in use. Laptops used for home working should be securely kept at home and not brought into the practice unless necessary, and then to be stored with the others on the premises. A review of their physical security, ensuring that doors have codes or are lockable and there's other access restrictions in place. And their CCTV to be upgraded to ensure it is working at all times to be used in these kinds of instances. Staff awareness and training has to be carried out to ensure that good practice is always followed when using laptops and around password management and security.